4 individual exercises that are really helpful and effective for strengthening your pelvic floor, and also very helpful if you are struggling with incontinence or pelvic prolapse. For the first exercise, you want to grab a fold-up towel, just about this much thickness, place it underneath your knee here, and you're going to be lying on your side, just like that. The back leg, we want the foot to be flat up against the floor for some stability. We don't really want any intentional core bracing, any intentional pelvic floor contractions. We are just working on a specific muscle called the obturator internus, which is one of the muscles that are forming our pelvic floor. So get a towel, put it right there, and very simple. We just want to start lifting that foot up just a little bit and back down, okay? And you want to try to aim for around 30 to 50 repetitions, depending on your endurance and your strength. You may find yourself do 20, 30, or all the way up to 50. It's fine as well. Then of course, you want to repeat on the other side. So just flip over. Same thing. Move out there, back leg straight, back foot supported on the floor. Just lifting. Just like that. And if you have never done these before, you actually might find yourself get pretty sore and tired after about 10 to 15. That's okay, just do your best. If today is 10, your max, maybe next time it's 12, maybe the next time is 15. And then you just gradually build up your strength to be able to do more repetitions with each round. The second exercise is to strengthen the lateral hip muscles, also known as our glute med. So sometimes it helps to have a band around your knee here, but if you don't have a band, that's totally fine as well. You can always add more reps if you need to. Lie on your side. Again, we don't really want major core activation going on here. We really just want to focus on engaging the muscle in the side of the hip here. So I like to place one hand on the floor in front of me for some stability, and then from there it's just a tiny bit of a lift up that way. And you want to start feeling it just kind of right around there. This muscle is the one that we want working. Okay, just make sure you're not doing something like this where you're actually tilting your body forward and backwards. We want a nice, stable, solid torso and just the hip to be the only thing that's moving. I would say aim for about 20-30 repetitions again. If that's too much and you're getting fatigued, it's fine. Just do fewer and then build up your strength. And you repeat the same thing on the other side. Like this. All the way up to 20-30 repetitions, or until you can't do it anymore.